we're going to do an AP and a lateral scapula next. So we'll start with an AP. For this, what you're going to have your patient do is kind of salute you. So palm up, facing away from your head. Central ray from this, you want to be about 2 inches below coracoid and 2 inches in from the medial or the lateral aspect of the body. 2 inches below is usually going to put you at the level of the armpit or the axilla, and then you're going to go 2 inches in from there. So Libby looks perfect right now as far as my central ray goes. I just need to line up my Bucky. I've got my left marker. You guys can put it in the upper outer corner or in the lower outer corner as long as it's not superimposing anatomy. What I do want you guys to be mindful of is palpating inferior angle and making sure that you have light below inferior angle. If you don't have light below inferior angle and you've got a significant amount of light above the shoulder, drop your central ray a little bit so that we're not clipping any portion of the scapula. This is another one where breathing technique is important. So just like we do for the transthoracic, you're going to have your patient breathe through the exposure. So I'm going to ask Libby to keep breathing normal, keep breathing, and click. From here then we want to do lateral. So what that requires, similar positioning to the scapular wide, but what we're going to do, so say it's Libby's left scapula that's bothering her, you're going to have her reach across, grab that other side, we're going to flip her around to an anterior oblique, and then again, your degree of obliquity is going to range from patient to patient. We want to feel that angle, feel where that AC joint is, and then superimpose those two structures. So degree of obliquity will vary. Since the patient's arm is crossing the body, you're going to have a little bit of OID, that's okay. And have Libby take a little step to the right. I'm going to turn my light on here a little bit more. Okay, so central ray, you should have probably an inch or less of light above the shoulder here, so I know I can drop down. You're going to be going midway in between, so you can feel the top and the bottom and in way in between. Again, make sure you have light below that inferior angle. My degree of obliquity is good. You're going to be, again, your longitudinal line should be right on the vertebral border of the scapula. And I'm going to have Libby, there we go. Line up my Bucky, take that off. To the left, so put your marker in upper outer or lower outer corner here. Give your patient GP. You would measure right through your central ray. For this one, you can just ask your patient to hold still and click.